Hi, my name is Troy Flint. I'm the Director of Public Relations for the Oakland Unified School District. Today we're here at Madison Middle School in Oakland's Bronte Park neighborhood to celebrate the opening of the latest in a line of school-based health clinics here in the Oakland Unified School District. This is not only another advance for the Oakland School District, but also for the Oakland community, as it's the very first comprehensive health clinic in Bronte Park. This is a high-need neighborhood, but within that scenery, Madison Middle School has made great strides, incredible academic progress, and a lot of social supports for students and families. We're going to learn more about what Madison does for the surrounding neighborhood, how it's a hub and an anchor for the local community, and how that role is going to be amplified by this new health clinic.
Change is painful. Change can't evoke pride. What I'm happy to say is change has come to Madison. We understand our purpose here in Bronte Park. It is to awaken and support our community's future leaders. I personally believe their future has endless possibilities, and I'm glad and proud to lead this team. We serve 326 students on this campus daily. We offer before and after school programs to better prepare our students to compete. We offer Saturday school programs to our most needy academic students. We extended our school day to keep our students off the street. Our endeavor since the beginning was to meet the needs of the whole child. The Madison Health Center, is in partnership with Alameda County, will help to expand those services to our students for years to come. I have to say, I am the kind of person who loves quality, and I refuse to give somebody something I don't want. So I'm happy to partner with Alameda County as they begin this partnership with our students. I want to thank some of the same individuals that Benicia commented on. Our feeder schools, our community, our school nurse, Juanita Daniels, has worked extremely hard. The services that will be offered to our students include dental services, nutrition services, not just for our Madison community, but ultimately to our feeder schools, which are Brookfield, Bronte Park, Esperanza, and Korematsu, and Lina Wilson. And ultimately, it will be opened up to the community. So although it's opening today, in the next couple of days to our Madison students, ultimately, we will open up these same services to our community.
We were able to open this clinic, and people say, okay, oh, that's nice, it's a new clinic. But why we were able to open this new clinic is because the City of Oakland, the County of Oakland, and the school district have had this partnership. We didn't seek them, they sought us because they see us working in a different and new way. And with the budget cuts and the issues that are happening in the schools, we who work in government have to break down the walls and work together. We have to use our money smarter and better. I'm very proud, Tony Smith's not here, but Tony Smith and I had a joint cabinet meeting between the city and the school district this week. Was it earlier this week or last week? Earlier this week. And we came up with some amazing ideas of how to share things and maybe save some money and do a better job of serving your community. So this was not an accident. This is very special because in the City of Oakland, the County Health Department, the school district, and the city works in new ways. And so I just want to end it here. I helped as a school board member open high school clinics. We're going to have 8 middle school clinics. We're doing this so that our children will be healthy, so that we can give them hope, that we can give a promise. Only about 30–40% of the kids traditionally in this neighborhood graduate from high school. We're going to change it with leadership like Dr. Taylor's, with partnerships like you and the parents and the neighbors here. And it's going to be our whole responsibility. It's not just the school districts, but it's going to be the mayor's responsibility. It's going to be the grandparents' responsibility. It's going to be the responsibility of everybody in Oakland. So young people, we have a lot of dreams for you. We want you to reach your dreams, and you tell us how we can help you, but we've got to work together, and I wish you all a lot of luck, and please sign yourselves and your families up to use this clinic, because if you're healthy, you'll do better in school. Thank you.
I want to specifically thank Dr. Taylor because When Dr. Taylor walked on this dirt called James Madison Middle School, it was a school that had less than 200 children. Former school board people were thinking about closing the schools. There were fights every year, everywhere around here. It was just a mess. I used to work here as a parent liaison for Project SOAR. There are still people from Project SOAR like Mr. Adimu that is still here working with children, and our other children that are working with our after-school program that never gave up on this school. And so we want you to know, young folks, that there's a history here in Sobrante Park, and for you to know where you came from, that this is a good community, it's a middle-class community, it's a changing community, mostly homeowners down here. We're just not by fly-by-night people. We're not a dumping ground. We're a thriving, loving, caring community. I want to also say to the public that I am so proud of these students. From going from a school 4 years ago with less than 200 children to over 300 children and growing, where we have charter schools coming, trying to take the best that we have to make them look better. Okay? Tell your friends, there's no better school than Madison Middle School. And there's no other school than Sobrante Park Elementary in Brookfield. Okay? So be proud of your school, be proud of your neighborhood, and especially be proud of yourself.
Sure, but I just want to thank all of the folks that worked so hard to bring this about, especially Dr. Taylor, Safe Passages, Elevate, Philanthropies, the County of Alameda, and everyone else. And all of the youth here, please take advantage of this. This is an investment in you. Please take advantage of it, because this determines your future. It's not just about looking at health disparities, it's about looking at the underlying causes. And in these communities, with these types of collaborations at multi-levels, this is what it takes in this economic downturn. So again, we appreciate all of the collaboration. It's a lot of hard work. Thank you very much.
This is just one symbol of hope, but it's actually one of 16 such federally qualified school-based health centers in Alameda County. And in Oakland alone, there are 9 new ones coming. We have a simple vision. We want to make Oakland Unified School District the first major urban school district in the nation to guarantee universal access to primary care as a function of school enrollment. Actually, what this clinic does is bring people into a supportive, caring environment where they can access the health services necessary to achieve their birthright of the ability to thrive, not just survive, but thrive. This is actually a new vision of a supportive service infrastructure for schools. And it isn't actually done with the supportive philanthropy, though, as we're so grateful for the supportive philanthropy. The business model behind this clinic is actually a unique collaboration of public sector entities. The vast majority of the operating budget of this clinic is sustainable indefinitely. About 70% of its operating budget is generated through the fees it collects for the services that kids and young people consume in the clinic. So this will be here forever. So I want to close with a note of gratitude to the Public Health Department, will actually be the operator of the clinic, and all of the staff of the Healthcare Service Agency who are helping define the nexus of public health and public education. This clinic represents new resources to schools that we've asked for too long to be both educator, therapist, doctor. Now let the professionals come in and help you so you can do what's already being beautifully done in this school community. Thank you.
Good morning. Wow, this is really exciting. And I want to start by congratulating Dr. Taylor. You are such an inspiration and such a leader, and these students are so blessed to have you as their leader. I also want to tell you that part of our work in public health is making a community healthy. So in addition to providing medical care, which we will be doing in this clinic, we also have to work on prevention and work with community members. And it was so great this morning walking in and seeing so many members of this community here that have been part of our work since 2004. In fact, Madison was one of our partners when we had an activity called House Calls, and we brought public health staff and our medical staff and provided a day of free medical care, and we went door to door and surveyed the residents of Sobrani Park to find out what they wanted from us to help them make them healthier, make it a healthier community. And we've been working in this community since then. So in addition to the medical care that we'll be providing, we'll also be doing a lot of prevention and making sure that not only the kids here, but the entire community is healthy.
We're here now speaking to Dr. Jeffrey Watson, a product of Oakland Public Schools all the way through, and now a successful, world-renowned physician who's still giving back to the community after all these years. Dr. Watson, thanks for joining us.
Thank you, Mr. Flint. It's really a pleasure to be here. As you know, I believe that your health is your wealth, and when you have your health, you have everything. And it's so important that the community is looking at young people and putting together clinics like this to prevent disease, to look at the dental problems, nutrition, and also address the psychological and emotional issues that a young person will go through in the community. It's a perfect fit. It's just fantastic, and I'm glad to offer my services to the clinic.
So, Dr. Watson, you have your own wellness clinic in North Oakland. Can you talk about what you've learned from that practice and how it might inform what's going on here at Madison and in other communities?
Well, I found in working in that clinic, I worked there as a child with my father, Dr. James Watson, and he really focused on taking care of people from the community, particularly people who were low income, uninsured, or had what we call disparities in disease. One of the things that I found is that in the urban communities, North Oakland, as we took care of African American patients, is there is more incidence of heart disease, of high blood pressure, violence, substance abuse, psychological issues, and so we try to deal with those things utilizing ethnic sensitivity. And one of the things that I think that is very important here is there's great cultural diversity. We've seen the Latin dancing, we've seen African Americans, we've seen Asian, we've seen Caucasian, just a great mixture. And I think that it's the ethnic sensitivity is going to be a real important part of it. And that's one of the reasons I've offered my care here. And I think that's what we do in our clinic. People feel comfortable. If you went to a place where someone spoke only Spanish, you would feel more comfortable if they understood you. And in a place like this where you're going to have African American students too, they're going to want to feel comfortable with someone that understands what their community is like, their neighborhood is like, and can be sensitive to those needs.
Thank you very much, Dr. Watson. That's a graduate of Crocker Highlands, McChesney, and Skyline High. We're here now with Tim White, Assistant Superintendent for Facilities Planning. Tim, you've been instrumental in helping to build this from the ground up, coordinating the partnerships that made it possible. Talk a little bit about that whole process, bringing it from the drawing board to reality.
You know, Troy, that's probably one of the most exciting pieces of work that anybody could ever do, right? I mean, to have an idea, to have a vision, and be able to like breathe life into it and actually see it take place, take shape, and then to have it actually utilized and draw people in. It's just this whole process of actually building and erecting structures, but then those structures actually have to have some spirit and some life breathed into it. And so it's not complete unless you breathe a life into it. And so we've built many, many structures. I think Madison right now, the health care clinic sits in the context of the entire set of work that was done at Madison in this entire Sobrani Park area, and it's just nothing short of extraordinary to me. The healthcare clinic sits here in the context of a multi-million-dollar improvement to the entire school site, and Madison is one of the most beautiful schools that I've ever seen. And right now, it's almost hard for me to contain myself. I'm just like so excited, dude. I've seen this thing take place not just on this campus, but in one of the toughest neighborhoods that we've got. So Bryony Park has got so many issues in terms of urban bred issues. And in many cases, it's so easy to give up on a neighborhood or a community that has so many issues. The issues associated with violence and crime and drugs, and what this school district has done is not give up on this area. We've invested in this area, resourced it so well, and it basically is inspiring to me because it just shows that you don't necessarily have to be shaped by your environment. We can shape environments to serve us to our purpose. And so in the framework of full service community schools, this school district has done a great job in shaping this school that's in the middle of the oldest community in this entire city to create services, resources, and a safe place that's not only beautiful, but functional and vibrant and full of life. It's amazing.
We're joined now by Kimmy Watkins-Tart of the Alameda County Public Health Department. Kimmy has had an integral role in this project from its beginning. Thank you for joining us today.
Thank you for having me.
Would you tell us a little bit about your specific position and how you've helped to take this from dream to reality?
I am currently the Director of Community Health Services, which is a division of the Alameda County Public Health Department. And so my division oversees the programs such as dental, nutrition, tobacco control, as well as tattoo removal and several other programs. And when the school asked if we would consider being the medical provider for this, our health department saw this as an opportunity to extend the work that we were doing already in the community with the residents around our city-county neighborhood initiative. And so this was a great opportunity, and we were very happy to have been asked. And so I was asked by our public health director to co-lead this with our director of nursing. And so she and I basically took the bull by the horns and began the planning process. And the way that we actually began the planning for this clinic is that we conducted focus groups in the neighborhoods and with parents and with students in the schools to ask them what services they wanted us to provide, because there are a lot of services we could provide here, but we wanted to know what mattered to them. And so the services that we're going to be implementing really are the services that they selected. In addition to that, we're going to have a community advisory board, which is going to be made up of stakeholders from the community, parents, staff and faculty, as well as students, to help us to keep the clinic functioning well, give us advice about new directions to take the health center in, and help us to ensure that this remains the kind of clinic that everyone will be proud of.
And what specific things did people say they had an interest in seeing provided here?
Most of the residents really wanted to make sure that we had basic services for their children, so basic checkups, immunizations, treatment for common cold, flu, those kinds of things, as well as dental care. Dental is a big, huge need in most communities. And so they wanted to make sure that we could provide the preventive and treatment services for both children and adults. And so those are the two areas. In addition to that, they also wanted us to provide a wide variety of health promotion activities. So they wanted us to be able to address things like violence prevention and grief and loss. They also wanted us to focus on depression and those other kinds of things that are not so much physical health, but really do make a difference in terms of quality of life. And so we were happy to be asked to put those services together.
This is the entrance to Madison Middle School Clinic. It's also a doorway that's going to take us to a new place for the Oakland Unified School District and Oakland as a whole. What we've seen here today with the debut of the school-based health clinic at Madison is really a model that we're going to replicate throughout the Oakland community. In addition to high-quality learning in all of our classrooms, we're going to supplement that across the district with a full, rich range of resources and support services that address the social dimensions and some of those social problems that interfere with the level of learning we want to see occur in our schools. We all expect big things from our children. We ask a lot of them, but we must also expect a lot of ourselves. And that includes creating the conditions in which high levels of learning and social growth can occur. Providing for health is fundamental to a kid's ability to learn. If you're not healthy, you're not alert, you're not well fed and taken care of, you won't be able to succeed to your potential. This clinic is one more step down the path toward an Oakland Unified that provides the means for all of its students to reach the best. Thank you for joining us today.